Hello, my name is Jay Huang. I'm a junior pathology attending in the United States. I go over cases almost on the daily from head to toe. If you're interested in that, give it a like and subscribe. Without further ado, thank you to Johns Hopkins Medicine Pathology, Surgical Pathology Unknown Conference. Thank you to Dr. Barbaran and Dr. Law. This is a 46-year-old female who underwent lung resection for a lung mass. So what we see here is we see a well-circumscribed nodule surrounded by relatively normal/reactive lung parenchyma. So here we see slit-like blood vessels with a cellular background. And closer up, we see that these cells are spindled, and they have sort of a school of fish morphology. They're not too atypical. They're relatively monotonous. There's no atypical mites. There's no anisonucleosis, meaning the nuclei are different from each other, which is not the case here. And there's just some background lymphocytes, but there's just a inconspicuous nucleoli or two, but otherwise unremarkable. So is this a leiomyosarcoma? No, because it's not atypical. Sclerosing pneumocytoma, those are biphasic. You'll see two cell populations. You'll see like an epithelial component and a stromal component. Here we don't see, we just see a stromal component with vessels. Lymphangioliomyomatosis. So this is, you'll see a young female patient typically who has shortness of breath, and you'll see emphysematous, like very large cysts in the lung, and that is not what we see. So this is metastasizing leiomyoma. So this patient had a history of a leiomyoma or fibroid that was treated with hysterectomy, and this is best regarded as a metastasizing leiomyoma. Greater than 40% of retroperitoneal leiomyomas were reported in patients having concurrent uterine leiomyomas who had underwent previous hysterectomies for uterine leiomyoma, suggesting multifocal origin. Metastasizing leiomyoma results from hematogenous spread of uterine leiomyoma, most commonly to the lungs. A key to the diagnosis is twofold: the history of a leiomyoma or hysterectomy for the same reason, and the low power view of the lesion being a well-circumscribed nodule. Generally, metastases to the lung present as well-circumscribed delineated masses, whereas primary pulmonary masses tend to be infiltrative and spiculated, like adenocarcinoma. Metastasizing leiomyomas are shown to be clonally related to a patient's uterine leiomyoma, and they are hormonally sensitive. The diagnosis of metastasizing leiomyoma must be made with proper rule-out of a metastatic leiomyosarcoma. Leiomyosarcoma has greater cytologic atypia. Sclerosing pneumocytoma is a benign primary lung neoplasm. You have the biphasic population of cuboidal epithelium that resembles type 2 pneumocytes, along with round stromal cells. And lymphangioliomyomatosis, exclusively in premenopausal young females and associated with tuberous sclerosis complex. So, all right, well, thanks so much for listening. I'll see you all next time. Bye.